Today we are going to discuss the minor criteria of the rheumatic fever. Just like the major criteria, the minor criteria is very easy and very simple to memorize. So for the minor criteria of the rheumatic fever, there is an acronym which is by the name of RAPE fever. RAPE, double P space fever, where the R stands for the raised inflammatory markers like ESR, CRP, and the TLC count, while the A stands for the arthralgias. This P stands for prolonged pure interval, which is generally reversible, and this P stands for previous rheumatic fever, and fever stands for elevated body temperature. One thing which is very important in this criteria is when arthralgias and prolonged pure interval, they are out of the minor criteria if the major criteria includes the carditis as well as the arthritis. If arthritis and carditis are part of the major criteria, then the arthralgia and the prolonged pure intervals are not included in the minor criteria. These are excluded if the major criteria includes the carditis and the arthritis. The second thing is the raised inflammatory markers in the form of ESR. This may be divided into two categories. Either if the patient is having high risk, so an elevated level of more than or equal to 30 is sufficient. If the patient is low risk, so he needs to have an ESR of almost 60 or more than 60. And CRP stands both for the high risk and the low risk as more than or equal to 3. So for low risk we need to have the elevated ESR of more than 60, and for the high risk if it is more than 30. Now the fever which may be usually it is high grade. It is elevated body temperature of more than 38.5 degrees C, but this can be low grade as well, up to 38 degrees C. So if the patient is low risk, he needs to have a high grade fever of 38.5 degrees C, or if he is high risk, this 38 is sufficient to make the diagnosis. So this is the minor criteria which can be remembered simply by the RAPE fever, and to apply it's very simple and very easy to memorize. Thank you very much.